Yes, welcome to the platform. We are continuing with our topic. We are continuing the topic, and today Miriam Mumbo is in the house. Welcome. We want to see conditions that we have, and they are evident that these conditions have been treated by complementary medicine plus conventional medicine, and the people became well. You see, we cannot be just relating complementary medicines like herbs that we take and the practices, and we don't compare them to our natural hospital medicine. Now, today we are comparing the conditions that herbs have treated, and it's evident without laboratory check. But we will see also why should you get to a hospital, get laboratory diagnosis so that you can be treated well. There are several conditions that we know that when you are at home and you cannot go to the hospital, you get some remedies, and just a minute. You get some remedies at home, and then you become well, you see. Then there are some conditions that you really need to go to hospital and be diagnosed by the hospital medicine so that you can be well. So today, when it comes to herbs at home and you want some anti-inflammatory, it seems like it is a first aid that you can take when you are at home, and you become at least well before you do what? Before you go to hospital. Now, let's continue with our topic here, and we see which first aid can you do so that you can conquer some things, some ailments when you are at home. Now, we say this, complementary medicine has varying levels of evidence. The herbs, the what, they have varying levels of evidence. And I'm trying to get some pictures so that as we continue, we can get to know what we expect as we go on. Because some things it's good to have evidence as we talk, as we continue. So we will say that complementary medicine has have had varying evidence of curing, depending on the condition. Below there are some diseases we are going to go through, and we see the varying conditions that have been treated. Like we start with the malaria drug that we have that we saw, which is called Artemisia annuna, which is produces artemisinin for malaria. It was used in the past to treat malaria, used in but it's still used in modern facilities as a tablet. And you see, it cures malaria, and it has strong proof and global proof. But now we have another here, because as we talk about herbs in relation to the hospital drugs that we use, we really need to check the drugs and the use. We don't just say these are herbs, they were used to cure. No, we should know the problems. We should know the problems that these herbs used to cure, and why did they evidently go to the laboratory and bring out the drugs that we use. Now, there are some people with chronic back pains, and osteoarthritis. There are some people with chronic back pains, and welcome Miriam Mumbwa, welcome Jamaican Uncle. Today we are talking about conditions that were treated by these drugs that we've been discussing, although we have not finished them. Before I finish, there is one famous drug that I will talk about, and then we see. Now, evidence in osteoarthritis, there are so many things that we do, like yoga, acupuncture, and massage therapy. Massage therapy started from way back, and it is being practiced even for now. It improves pain and functions, musculoskeletal. So when you are doing yoga, relieving yourself, yeah, King Re is in the house. Yeah, King Re, welcome. Now, yoga, tai chi, they improve the muscles, strength, power. You understand, and then you feel you are cool. But there is another one that we talked about. We just talked about ginger. In the past, ginger was used for nausea and vomiting, and even right now, if you look at pregnant women, they usually like walking around with biscuits that are blended with the ginger. Even at home, acupuncture and chemotherapy was used. You see, these are things that were used from before, but they are emerging nowadays to help. So when you are at home and you are feeling nauseated, and you don't have the anti-nausea, you can use ginger. You see, it is very important to learn on this drug so that you can know to get a first aid before you get to hospital, before the symptoms come on and grow before you get to hospital. You get it? So for nausea and vomiting, people still use even right now ginger to relieve the nauseated, for to relieve the nausea. You get it? Before you get to hospital having nausea, you can take ginger to relieve it, because vomiting, it is losing electrolytes. And then we have mild anxiety and stress. Mild anxiety and stress. I'm talking about this, but we will see even the practices. Practices, we are starting practices tomorrow. Medical practices, just as surgeries in before times, we had some practices that were done. Now, mild anxiety and stress, mindfulness, mediation, yoga, breathing techniques, some herbal options like chamomile. We talked about them, you remember. Strong evidence of stress reduction. When you are exercising and doing your yoga, at times it relieves stress. And some herbs like chamomile, we talked about them, they relieve stress. And then there are some drugs and herbal drugs that were used in irritable bowel syndrome. We talked about them. Irritable bowel syndrome is when your stomach is always acidic and it's bloating and pain every time because of acid. We talked about it somewhere. We talked about peppermint oil capsules, that is a herbal thing. We talked about low FODMAP diet, nutritional based supplement, complementary therapy, and then gut direct hypnotherapy. There are some, if you've been following, please, if you've not gone through the topics that we were going through, go through them. And if you have a question about those topics, please just ask any question as we go on. Irritable bowel syndrome was treated by peppermint oil. You see, irritable bowel syndrome is acidity. Acidity sometimes can destroy your stomach. Even digestion can be worse. And pain is not a good thing when it comes to the stomach. So acidity goes. And then we have depression. Hmm? Jamaican uncle, I'm here, Jamaican uncle D7D, welcome. We have another Jamaican uncle, welcome. Now, we as you age, it's good we talk about this herbs so that we know how, as you age, you take a glass of herbs that will help you instead of taking concentrated medicine every time. Now, we have depression mild to moderate. How was depression treated? St. John's wort. We talked about St. John's wort. You remember, with caution due to drug interaction. So St. John's wort it relieves you the depression by making you feel relieved and feel nice. Omega-3 fatty acids, they help. And also exercise is in practices. You are very strong, Jamaican uncle. I always wish to be strong like you. Nice, you see. Let him give us the his secret to be strong. Give us the aging secret. Now we continue on diabetes, supportive role. Diabetes, is insulin resistant. So the only thing you can do is give a supportive role. Some complementary approaches like cinnamon, small glucose reduction. Cinnamon, people? Yes, it helps when it comes to low. Don't need dunkling. I will one day. I see an uncle with two profiles. Now let's go on St. John's wort. You use St. John's wort, and then we have diabetes. Diabetes, some complementary approach shows cinnamon can reduce glucose, and lifestyle-based therapies like diet and yoga. Now, when it comes to hypertension, people that are struggling with high blood pressure, there is something called dash-like diets. Dash-like diets, mediation, yoga, and garlic supplements. Mediation, it's relieving yourself from stress. Yoga is relieving yourself from stress. And then we saw garlic supplements, modest, they relieve a bit. They release the tension in your blood vessels. So garlic is common. We get garlic every time, but you see, it helps everywhere. We just talked about garlic yesterday. So insomnia is sleepless nights. You don't have sleep, and you want sleep. There were some things that they were done, like cognitive behavior therapy, and those ones are we will talk on practical issues when it came to medical problems, not the drugs. In the past life, herbs were used as drugs, but in the medical practices we have not discussed them. We are going to discuss them, just like in the modern world where we have surgeries, we have the practices that we do, like the physiotherapy, all those ones. You understand? Those ones, they help in the modern world. Even in the past, they were having their herbs plus the practices. We will see the herbs plus the practices. Now, in insomnia, we have said mediation and sleep hygiene. Sleep hygiene, valerian root. We talked somewhere about valerian root mixed, but it helps when you wanted to sleep. You take valerian root, you boil it, you drink a cup, and then you feel dizzy and you sleep. You see, and then we have inflammatory conditions like arthritis. Inflammatory conditions like arthritis, and we talked about turmeric. You remember yesterday, the topic of yesterday of turmeric, an anti-inflammatory, which was containing curcumin. Curcumin, you remember? The curcumin is what was the anti-inflammatory, and it was helping when it comes to problem with, you remember that, metabolic inflammatory conditions like diabetes, thyrotoxicosis, thyroid problems. You see, we talked about it, and we saw how turmeric is helping in these conditions. And then evidence support anti-inflammatory effects, curcumin. You see, now that one was it was evident as we talk about these drugs. You appreciate that these were not drugs uh, came from yesterday. These were drugs that came way forward. When you're given an antimalarial, it is a drug that it came way forward, and it came as a result of a herb. So it was just manufactured and taken the components. So malaria, we have said it was artemisinin annua, which is still used even now in form of tablets. Chronic back pain, we have said acupuncture, yoga, and massage. Evidence reduce pain and improves mobility. Mobility. Now we have osteoarthritis. Osteoarthritis, we have, which we do sometimes tai chi, and then there is a drug called glucosamine. Glucosamine and curcumin. Curcumin from turmeric. Curcumin from turmeric. It improves joint stiffness, and functions of your body. And then we have chemotherapy induced nausea. You use ginger and acupuncture. When we are starting to learn about medical practices in the past, you will know what acupuncture is. You will know what acupuncture is. It reduces vomiting. Ginger reduces vomiting. The acupuncture reduces. Well, I'll come back to Africa. I will teach you the secret. Yes. Uncle said when he comes back to Africa, he'll teach us the secret of staying healthy and young always. Nice one, nice one, nice one. Pregnancy and nausea. Pregnancy and nausea always we use ginger, and it is used even in conventional medicine. In a hospital, it's a practice. If you are pregnant and you are really vomiting, we advise you to use ginger so that you can reduce the vomiting. Now, irritable bowel syndrome, we have talked about it, the peppermint at hypnotherapy, reduce pulse and bloating. So, irritable bowel syndrome, I've talked it, it's about bloating, it's about acidity. So, when you use peppermint oil, you see it helps reduce those. And then we have anxiety disorders. Anxiety disorders, like when you are so anxious about everything, excited about some things, and always eager and confused of what to do next when you're starting. And there are some people who cannot even stand in front of people and perform before doing something. So this one, it's they were doing mindful mediation, yoga. Chamomile tea helps to relieve the nerves, reduce cortisol, and improve emotional control. Chamomile tea, it's used even right now from the past. You get it? Mild depression therapies like exercise, omega 3s, we've talked about it. Go find St. John's wort. Go find St. John's wort. When you are thinking a lot, you are thinking like you are getting into depression, use St. John's wort and adjunct psychotherapy to help you, to help yourself. Hypertension, we've talked about garlic supplements, although it reduces a bit. This can only be as a first aid. As you rush to hospital for help. You get it? Yoga relieves you. Then we have something called type 2 diabetes. Type 2 diabetes, a minute. If you have a question, please today ask. We have really talked about some components. We have talked about very many issues of herbs, and we really need to talk about, ask questions, we discuss. This be a discussion. Uh, let this be a discussion. Let's interact because every person comes from a background. Thank you, Miriam Wambua. I'm really talking. I'm a doctor, but I'm really getting into herbs because there are some people that where they are, they may not get a quick facilities that can offer conventional medicine, but you are near the herbs that can help you as you sort yourself to go near a facility. So it's important to know these things. It can save a life. You get it? So diabetes, type 2 diabetes, some there are some things that they were using in type 2 diabetes, like cinnamon, uh, lifestyle medicine, diet, and yoga. You get it? These were the things that people they used to, our forefathers used to take cinnamon to reduce the glucose levels. The cinnamon, everyone knows cinnamon. And then when you lack sleep and you cannot sleep well, there is something called mediation therapies. You see, we are mixing therapies plus the herbs. So we have started with the herbs, but the practices will come after we have finished about the herbs. Now we go to practices and we compare previous practices, medical practices, and conventional, what we do in hospital. We compare, we see if it was an aged practice let me say, how can I put it? We check if they are going hand in hand, if there was a medical kind of a medical part in it, or we are just or doing totally different. But now we have seen in herbs, it is like complementary medicine of our forefathers gave a step to the conventional medicine that we are using now. And that's what we are discussing. Miriam Wambua, thank you so much for your compliment. Please share the information to your friends. It's very important. Now, insomnia, we have said valerian root. They used valerian root and mediation. Mediation, we see insomnia is lack of sleep. When you are staying at night and you are not sleeping and there is no sleep, you get valerian root, you boil it and drink. It gives you like sleep, you see. And then we have migraines. Migraines, those people that suffer every time, headaches. Vitamin B, riboflavin, that is what we use in our facility to increase melatonin in your brain. But acupuncture and magnesium was the practice of before, which is being even practiced right now to some hospitals. It reduces frequent attacks of migraine. So when you have migraines, don't use a lot of painkillers because you will be just reducing it for some time, then it comes back. Use riboflavin, vitamin B, which is riboflavin. It increases melatonin levels and you feel sleepy. And then we go to rheumatoid arthritis. I've really talked about inflammation, and inflammation is a very consistent thing when it comes to all types of arthritis. Arthritis is categorized by inflammation, swelling, feeling pain, and warmness, and all those. So inflammation, if you have a member in your family who has arthritis and is taking drugs of pain and is feeling, no, this is too much, introduce that person to turmeric, which has curcumin. Huh? Turmeric that you use always in food, let this person drink it. It is an anti-inflammatory, anti-nausea. You get it? Fish oil, it really helps. This one came from our forefathers. I'm really comparing where we got our components nowadays. Anti-inflammatory benefits. And then we have our ladies, our sweet, lovely ladies or women with premenopausal syndromes. Yeah? Pain, vomiting, and mood swings. You see, when a woman is menstruating, that is the time the moods and the hormones are rushing against each other, hitting, beating each other left, right, and center. What do we do? Our forefathers were using chesterberry. Chesterberry. Chesterberries were the ones that were reducing this hormonal crash. You get it? With magnesium, but nowadays you use B6. B6 reduce mood swings and cramping. So if you have Chester berries, find out where you can get if you are a lady and or your daughter is having these problems. Introduce your daughter to Chester berries to reduce mood swings and cramping. You see, a painkiller, cramping is muscle spasms. The muscles are doing this. As they spasm, you feel pain. You feel pain. So what you really need is to get something can reduce the spasms so that the pain can stop. You don't take painkillers, you take antispasmodics to reduce the pain. So painkillers may make it worse or may relieve the pain so slowly. So Chesterberry was used in the past as an antispasmodic, and then it makes your muscles of your womb to stay calm without spasms. And you see, when it is the same thing when a woman is going to labor, your uterus gets spasms so that it can push and push so that it can pull the baby out. So it is the same thing when you're going to menses, because the womb itself, it gets spasms, it contracts as it releases so that the inner lining can be out, and then you get menses. So you don't go for high levels painkillers, you get something called antispasmodic. The drugs that we use in hospital right now, they are called Buscopan, but as doctors we call it hyoscine bromide. Buscopan is an antispasmodic. If you are really nauseated as you were in menses, we give you metoclopramide, which comes from the same herbs that we've talked about, turmeric and the others. Vitamin B6 help a lot when it comes to nerve issues and you are in menses. So if you use chesterberry, it will be like an antispasmodic and it will give you B6 and it will reduce your mood swing and our ladies will be happy and we will always work with them well when they are in menses. You see that? Very nice. Very nice and appreciating. I appreciate your likes as we continue. We need our ladies to be happy. We need our ladies to always work without stress. When they are at work, they are feeling nice. You get it? So you introduce the ladies to Chester berries if your daughter is having a problem or you yourself, because there are some people with these problems. And if it is so worse, you visit a hospital. But when you are at home, you can use just Chester berries for premenstrual syndrome. It is called premenstrual syndrome. Pain, mood swings, and vomiting. And then we have menopausal syndrome. Menopausal syndrome for our women who are getting to there. You see, there are some remedies you can use, and you feel nice at home without going to a doctor. And unless you have adverse, so bad, you have bad symptoms. But when you are at home and you are facing menopausal syndromes, you see, this is life and people go through that. So when you are facing them, you can use isoflavones. Soy isoflavones. The soy. You know soy isoflavones. Don't listen to that complicated word. You know soy that produces soy sauce. It helps in reducing menopausal syndromes. You get it? Black cohosh. Black cohosh. Find out if you have it in your neighbor or your compound, but that one has mixed evidence. You may not get it. Black cohosh. It makes premenopausal syndrome, the neuropathy, burning sensation, anxiety to go away, and reduces hot flashes. You remember hot flashes when it comes to menopausal syndromes? Yes. And these are the things that our forefathers used to use. And then we got it and we decided now let's upgrade to we get the components, we make them the drugs. But when you don't have the drugs, because most components that are coming from soy sauce and black oil, they are so very expensive, and if they are so very expensive, you can get it at your supermarket and use them. You see, they are our children, our parents, our brothers and sisters who are asthmatic. And in the past, there was something called yoga breathing and breathing exercise. Improves symptom control. You see, when you are asthmatic, it means the airway is constricted and passing really little air. So you're not getting enough oxygen in your brain and tissues. So breathing exercise will help at that time. But they cannot replace inhalers. At in the past, there are so many there's no evidence of any herb that would help when it comes to asthma. That's why they were saying it was a bad omen that has come to the family. But later on, they came and got to replace it with the inhalers. But breathing exercise really helped. So for asthmatic patient or a neighbor or someone, always help by trying to don't let him not breathe faster when this person is under attack. As you get the inhalers, get the breathing exercise slowly in and out and until the histamines are gone away from your airway. Then there is chronic stress. People that have chronic stress mediation, adaptogens. There is a plant called adaptogens, e.g. ashwagandha. See, these are things that came from before. They lower cortisol levels, the steroid that your brain produces from your inner cortisol glands. You get it? So it makes your stress to go down. But in wound healing, someone has a wound. We talked about aloe vera as an antibiotic and very many things. And we talked about the two types of aloe veras that are for wound healing and they are medicinal. Go talk, look, study about aloe vera. We talked about it, and give us more information if you have it. For aloe vera, it was used as an antibiotic, an antiviral, and antibiotic. And then we saw upper respiratory infections like pneumonia, coughs. Those ones we talked about turmeric, we talked about herbal teas, we talked about vitamin C and lozenges that are used nowadays. But in the past, there are some leaves that produces herbal teas. We talked about them. Please visit the video and see short duration slightly. It helps in a short duration. Substance use disorder. Substance use disorder. It's like a person has taken a lot of ganja, bang, yoga, acupuncture was used to relieve it. Help craving and relapse. See, someone just can have just a craving of bang, uh, cannabis sativa. Someone can have a craving of cigarette. In the past, it was called tobacco. So the acupuncture and the craving was reduced by the acupuncture reduced the craving and relapse to the problem and yoga. You see, now we have talked about more than 20 things that the plants, the herbs have helped from malaria to everything. As we continue, I'll be cutting short and always reminding people about them so that you can get, sometimes you are not in hospital and you need a remedy. So you don't just choose anything when you need a remedy. You know what to do. As you go through these videos, you learn, you know what to do to get a remedy before you go to hospital. You get it? Now, there are some things that we've talked about, like pain, stress disorders, gastrointestinal, the abdominal problems, lifestyle diseases. You get it, like diabetes can come because of lifestyle. And then cancer cure claims and HIV cure claims. Those ones, you see, I met someone who told me that herbs helped him to cure HIV. So I really needed to find out what that herb is, but this person never brought it to me. So if we get any evidence on that, because I've really heard this many people talking about it. So if you meet someone and you've heard this person, please introduce that person to me. Do the research. You get it? We do the research so that we can know how to. Uh, Okay, just a minute. We can know how to do this research because there might be a hub, just a hub that we use. Mm, just a minute. You see, there can be a hub that and you know it has helped someone, but because you don't know who to tell. Yes, Marcia Thompson, welcome. Because you don't know who to tell, becomes a problem to research on that. A minute. You can have a research. Leila is saying he was never positive. You see, we saw evidence of herbal medicine is experience and time and results. So I concur with Leila. Maybe he was never, or maybe it was not there because we tested and he was positive previously, but he never brought me that plant. So what we can do is, if you know, there was time I was living at the coastal region of Kenya, and people are talking a lot of a herb that can heal. So we are still doing research. If you know of any herb that your grandfather used to do something, inbox me, tell me if you know it and how it works. Now we the cancer cure claims. When it comes to cancer, I think we will, after this, we will talk about cancer. We have no specific plant that has been used and cured cancer, unless if I find out, and then we will talk about it when we are talking about cancer. Now we have gone through all those facts, and you have seen the things that herbs have helped, even the current drugs. But there is something that I want us to discuss before I leave. There's something that I want us to discuss before I leave. Sorry, today I'm not using a software, so I will not share any. I will share no any picture, but I want you to know this called, in Kenya we call it mwarubaini. Mwarubaini. It's a really a plant that I was told this plant used to treat 40 diseases. And we'll start talking about it today. We see in really sense if it was a minute. I see if I can share that picture. If I can't, because I greet you all. My people are just in the kitchen cooking for iftar, but I'm listening. Thanks a lot, Leila. Now, I want us to start on it, and then we will continue with it tomorrow. We'll continue with it tomorrow, because we want to know how this plant used to treat 40 diseases. If you have ever heard about Marubaine and you are in Kenya, you tell me. You tell me, just a minute, tell me, we see how we can help each other. It is boiled, it is boiled. Uh, Listen to this. In Kenya, Marubaine, also called Marubaine, refers to the neem plant. Neem plant. If anyone who knows about the neem plant, which treats 40 diseases, 40 diseases, in 40 types of different kind of diseases. Now, let's see. Sorry. I'm trying to find how I can share the picture here so that we can see it. We start and rags intentionally. Now, there is no way. I think I'll project it tomorrow, because today I'm not using any software of projection. Uh, Now, the neem plant is a well-known medicine plant used in traditional medicine, especially in Ayurveda and African traditional medicine. Modern science has identified several bioactive compounds. Now, neem, in traditional practices, the plant itself, in Kenya we call it mwarubaine. Mwarubaine means 40, 40. So the neem plant, let me post here the spelling so that you can check it on your phone. But tomorrow you will see it, I'll project it. Let me post it here so that you can see it. It is called the neem plant. In African society, especially where I come from, it is said that this one treats 40 diseases. 40 diseases. And that's why we called it in Kenya Mwarubaine, 40 diseases. You see, it's a non-medical plant, and it has several bioactive. Now, in traditional uses, it was used as an anti-inflammatory, antimicrobial, bacterial, fungi, and parasites. You get it? And parasites. Oral hygiene. When you have problem, your halitosis, you have bad breath from your mouth, you take this mwarubaine, which is from the neem plant. They boil it and you drink the leaves. This thing is very bitter. It is very bitter. The neem plant is very bitter. You get it? It's very bitter. They were using it in as an anti-malarial. Listen, let's count the ones that we know. One, anti-inflammatory, like paracetamol. Two, antimicrobial. Antimicrobial, that is an antibiotic. Antifungal, antiparasitic, that is like anti-malarial. You say, you get it? Some parasites like hookworms. Then we go to anti-malarial. Those ones are five. Oral hygiene like mouthwash, toothpaste and mouthwash. You get it? We want to count why the neem plant was used. And then we have skin diseases like eczema infections, the neem plant itself. I don't know how you call it. Please tell us in your country how you call the neem plant. The neem plant, the neem tree, let me pin it. The neem tree, pin the neem tree. I don't know how you call it in your country, but in our country we call it mwarubaini because they believe it treats more than 40 diseases. So we have gone to five. But you see, bioactive compounds in this tree. Now, after research in the modern contemporary society, after research of the neem plant, it has azadirachtin. Azadirachtin. This one is a toxin. It is used to destroy insects, some insects. Imagine people are drinking an insecticide. When you use it, some insects die. But us, we use them as. That's why when it comes to herbal medicine, be careful and get a right person who has the right knowledge when it comes to herbal medicine. Because you see, this one it is widely used. If you ask everyone in Africa or in Kenya where I am, you will find Mwarubaine is everyone knows it. Everyone knows Mwarubaine and it's very bitter. But you see, the first thing it has as a dirachity, which is an Mercy, welcome. Mercy, as we welcome, I guess you know what we call Mwarubaine Mercy Grace. Mercy Grace, we are talking about the neem plant, which is Mwarubaine. Gedunin, Gedunin, they say it has an anti-cancer and anti-malarial activity. Anti-cancer and anti-malarial activity. Today, I'm just introducing this plant because it has been used a lot in Africa. I don't know if those people who are here and they are listening me from US and Jamaica and everywhere, do you have the neem plant where you are? Do you have the neem plant? Do you know its uses? Have you used it? Please tell us so that we can interact and know. It has something called salanin, which is insect repellent. You've seen those in repellents of mosquitoes. So the neem plant also acts as the insect repellent. It has nimbin and nimbinin, anti-inflammatory and antimicrobial. Hmm? Greetings to you, Mercy Grace. I like the live stream you did last night. Thank you, Mercy Grace, with the live stream. You will see good content attracts good people. Mercy Grace, congrats. Now we continue. Those are the hi everyone. Doreen Small is here. Although you've come late, please, Doreen Small, tell me if you have the neem plant in Jamaica, because we have started. I'm introducing it, and we will talk about it at large. Now, drugs that are conventionally derived from the Mwarubaine, which we talk about it as it cures 40 diseases. We will see tomorrow which 40 diseases. Yes, yes. You see, Doreen has said they have it in Jamaica, the neem plant. Here, Doreen, we call it Mwarubaine, 40 diseases, because we believe, our forefathers believed it treated 40 diseases. It treated 40 diseases. So tomorrow we will see which type of 40 diseases it treats. But today I'm just introducing this, and we have gone through all the treatments that We've gone, the herbs and conventional are counteracted and interpreted and integrated to treatment. Now, these ones, as you take the neem plant, Doreen, small, as you take the neem plant, I want you to know this. It has got an insecticide, which is called azadirachtin. It produces antimalarial, but is still under research, antimicrobial foundations, mouthwash, toothpaste, and skin problems, and potential anti-cancers. So these are the things that are continuing and are continuing to under research. Hmm? In Kenya, it's used so much. It is used even in veterinary because. But let me see. Let me see. Why? Just a minute. Let's see why they say it treats 40 diseases. And you see, in Kenya, it derives from that. It is called Mwarabaine because our grandfathers believed the neem plant can treat 40 diseases. Now, one, it is because of culture and traditional context. I want you to understand the 40 diseases is not precise count, but a way of saying this tree has many medicinal use. It is it can treat many, but it has no precise count of diseases. As we continue to learn, you who are watching in Kenya and you know it is called Marabaina, it can treat 40 diseases. It is just a way to show it can treat many diseases. And then it has got wide range of bioactive compounds, very many compounds in that plant. And we will see why you should not always take it and why you should take it again. Because you have seen it has several components, even it is insecticide. So as you take it, just know you are taking some components of insecticide. Now, it has been observed in malaria, skin infection, digestive problems, oral hygiene, fever, and wounds, and even sometimes in diabetes. Tomorrow we will see. And why the number 40? Because I don't know if you call it where you are like us. Why number 40? Why our forefathers decided to call it 40 diseases? 40 in many culture is a symbolic meaning of many and numerous. You get it? So, in short, neem is versatile and contains very bioactive compounds, so it should not be misused. Traditional medicine observe effects of many conditions. Scientific evidence supports some, but not all 40 diseases. The 40 is symbolic. I want you to know that. So it is. We have gone more than 1 hour. I say today I'm not going if I've not introduced the neem plant because it's a plant and a herb of interest. Many people know it across the world. Tomorrow we will discuss the neem plant alone. So if you have a question, I have like 10 minutes. 10, yes, 10 minutes. Who has any question that we close and wrap up so that tomorrow we continue with our topics? My aunt still boils the bark of the marubaini for treatment. Yes, oh, that is very correct. She still boils the bark for treatment. That thing is, Leila has said the aunt still boils it. And now, Leila, tomorrow we will see how it is proper to use it and when it's not proper to use it. Because some herbs from the past have really helped some people and some have really destroyed some people because some people have used a lot of herbs and usage of their lot of herbs like marubaini has given them gastric issues, have given them problems in the. So as we talk about the neem plant, we will see how we can help it. You see, we can see how we can help the generation not to overuse or not to overuse. You get it? So we it's a good discussion. Please don't, let me tell you one thing. When it comes to tradition and traditional practices, it is not it's very important to speak out. It is very important to say what you feel, because what you feel is what gives out drugs of this generation. Because if you tell me that my grandfather used this plant and I'm still using it till now, maybe it is the outburst and outcome of treatment of some cancers and you've never known. But so speaking out and giving me information about traditions, we used to do this. You see, Doreen Small has attested. They have. My time is out. I'm just talking. Please, if you have a question, give me. We discuss. As said, they have the neem plant and it's so bitter, and they use it where they are. Doreen Small is far away, miles from where I am. She is from Jamaica, and she has said that. So it can give us a way to help and do more research, just like any other plant that is under research. You get it? So let's interact. Let's talk about these plants. Tomorrow we are talking about the neem plant itself, how to use it, what it produces, because now you have seen it is producing even an insecticide. So everything that is suicidal, like an insecticide, can be harmful to yourself. So we will separate all these components in the neem plant and know how it was used by our forefathers and it never harmed them. You get it? Some practices in the traditional practices are so nice, but some may be giving some people problems. You get it? Like when we talked about aloe vera and we talked about the we talked about laxative. You see, when you have constipation and you take aloe vera, the one that can gives you laxation, and you go to the loo, you remove everything from your stomach, it may be fatal, because as you relieve your constipation, you are destroying electrolytes in your body. So overdoing it may be a problem, and you may end up again in hospital. And that's why I've said learning about herbs is very important, because it gives you the I think today people are really appreciating, because you don't have questions. Today everyone is okay, don't have questions. You see, it helps you to do what? It helps you to know what type of first aid you can do before going to hospitals in times of emergency. This person has fever. I don't have any paracetamol in my house, but away from my compound, there is this tree that I heard the doctor say it is an anti inflammatory. It reduces pain. Let me use it as I rush to hospital. You get it? And that's why I'm doing this. And there's been a very funny commotion of 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 complementary medicine, herb medicine, and conventional medicine. People think that doctors don't like prescribing herbs. Yes, they don't. It's because they don't know the dosage and they don't know how these herbs can react to your body, or the body can react to the herbs, because the doctors and the medical practitioners, they are trained on the molecules that comes from these herbs, and they give in a dosage. But you see, it may be so hard for you to, as a doctor, to give a glass of neem plant. You see, I've been learning a lot lately. Thanks, Benjamin, for teaching us. Welcome, Jay Kingre. And if you have any question beyond this, don't fail to ask. You see, it may be so hard for a doctor to tell you take a glass of neem plant, it is an antibiotic, and you really don't know if it is targeting gram-positive bacteria or negative, or it is targeting what. And that is the problems when it comes to dosages, and helps when it comes for to when it comes to what? To treatment of herbal medicine. You get it? But herbal medicines are the foundation of our medicines at par right now. We should preserve our cultures, and we should continue doing research on the herbal medicines. especially people that are at the coast, people that are at the coastal region of Kenya, where there are some people who protect the trees, the indigenous trees, the kayas. They call them the old men kayas. We call them wazee wa kaya in Swahili. They know every antibiotic, every tree that can treat what and what and what. And I've stayed in the coast and I saw that. So it is a very important when you learn of something, you appreciate it, we continue doing research. Maybe these problems that we have currently is because we are not appreciating our forefathers. Even the cancers that we have right now. If you are listening, please don't forget to like and share. Do a thumbs up, like the video where you are, and share. So that when when you share this, it gives more impressions to people and people come in to find out. But when you don't like and share, it don't give impressions online. So you share and like. No, I was saying now those wazee, those old people, they knew every drug. And now that this current generation we have come and we want to fight their education, it is limiting us to get the drugs that we need. It is limiting us to get the drugs of cancer. It is limiting us to get to fight HIV. If an old man comes to me and tells me that, doctor, I know this herb, it can treat HIV, I should not overrule that word. I should go find out why this plant can, this old man is saying this plant can treat this and this. Take my knowledge of the conventional knowledge of the laboratory at work, get that plant, get to know which components are in that plant that can come out with that. Why is this old man telling me this? You will never overrun what we call experience and knowledge from an old person. And that's why, as a doctor, I'm still giving respect to our generation who started them and giving respect to them for starting medicine until now that we are doctors. They were the main doctors at that time. So tomorrow, people everyone who is here, and you've been listening. Now that you don't want to ask questions, and you are okay, and you feel nice. I want to appreciate everyone. Jamaican Uncle at 8, I'll be with you. So you guys, as you watch me, know that at 8, I'll be at 8 Kenyan time here. At 8 Kenyan time. Find out where you are at 8 Kenyan time. What time is it? I'll be watching Jamaican Uncle. Here we see the Kingre, Mercy Grace, Leila TV. One day I'll come to be an anchor in your TV. Doreen Small, everyone appreciate. And if you have a question, you always know our email where to post the question. Have it's already 1 hour at the dot. I have like seconds, and no one has asked a question or what's happening. I'm a good teacher or what? Think I'm a good teacher. Share the information, everyone. We meet at 8 as we talk to Jamaican Uncle. Jamaican Uncle is our father who gives us wise words, like Benjamin the wise guy, and a very calm father who has love of everyone. And sometimes he guides. When I want to be guided on something, I make a call, I ask him, how do I go about this? How do I go about this? Visit the channel, show love to Jamaican Uncle every time, and always be at his channel for guidance. He is a person, he is a person who is knowledgeable. So when you are stuck somewhere and you want for assistance, reach out to him. Reach out to him. Yes, I will one day. I will, Leila TV. Leila, are you in the coast region or Nairobi? I really need to know if you are in the coast region or Nairobi. Yes, yes, yes. So have a lovely evening. God has brought rain. It's not too hot. We feel nice. Let's meet at that. Please remember to like and share, comment. We grow the channel. We talk to everyone. Be blessed, everyone. We see you tomorrow for Neem Plant. Bye.